Okay, so my presentation is on Streptococcus pyogenes, also known as Group A strep or GAS. It is popular in temperate areas. It peaks in the late winter or early springtime in the United States. It is a major cause of pharyngitis and cellulitis, and then children carry it in their throats. They're often a carrier. 10% of patients with this invasive illness present with pneumonia, and it's one of the most major causes of cellulitis. And then it actually manifests differently throughout the world. So in different parts of the world, it can present differently. The reservoir is in humans. It's in the skin and mucous membranes of humans, especially the nose, throat, and skin. It can be in people who are asymptomatic. Okay, so it can be in people and they're asymptomatic for it, but they're typically less contagious than people who do have symptoms. And then children are a reservoir for adults, so children can spread it to adults and lead to an infection for them. Morphology and features, so it's spherical and it's in chain or pair arrangement. It's gram-positive, non-motile, non-sporing, beta hemolysis, and like I mentioned, it's referred to as Group A Streptococci, or GAS or GAS, because it contains the Lancefield Group A antigen on the surface. And so they have like group-specific carbohydrates. It is susceptible to amoxicillin. The virulence contributes to the severity of the infection. So the more virulent it is, the more severe the infection it will be. It does produce extracellular products such as streptokinase, proteinase, and esterase. These are virulent factors that, interestingly enough, have actually shown to be function as digestive enzymes, and they actually provide the bacteria with nutrients from the host. So it just, creates that nutrient for them and makes it a little bit harder for the body to fight off. It adheres to human epithelial cells, including in the oral and nasal cavities and also on the skin. So after initial invasion, it can actually rapidly spread to other organs. It produces this M protein, which is resistant to acid and resistant to heat. And this is on the cell surface and the fimbriae. It helps attach the bacteria to the epithelial cells in the host. And then it also helps with resisting phagocytosis by white blood cells, actually. So this again leads to the virulence, makes it harder for the body's immune system to fight it off. And then also there's like pyrogenic toxins produced by some of these M proteins, and they can act as super antigens, which lead to the immune system to contribute to the damage. Some of the diseases include nasopharyngeal infections, including pharyngitis and tonsillitis, which are just inflammation of the pharynx and tonsils. There's also skin infections such as cellulitis, impetigo, and erysipelas. Erysipelas is basically red patches that usually show up on the face first, and they just are kind of raised margins. And this occurs when S. pyogenes infects the dermal layer of the skin, and it can lead to sepsis if it enters the bloodstream. And then there's also scarlet fever, which is basically just strep throat with a rash that appears. And then it can lead to invasive diseases. As I mentioned, sepsis can occur. But on top of that, it's also necrotizing fasciitis, which is the flesh-eating bacteria, and also toxic shock syndrome. And then this picture just has some of the symptoms of toxic shock syndrome. Signs and symptoms, so most common: fever, sore throat, difficulty swallowing, white patches on the tonsils, as you can see in the picture on the right. Has those whitish spots. The pharyngeal and tonsillar erythema is just that redness in your pharynx and your tonsils. And then tonsillar hypertrophy with or without exudates is the enlargement of your tonsils. So that's swelling, and then the exudates are actually what those white spots are called, and those appear on the tonsils typically. Group A, strep pharyngitis with the rash is scarlet fever. Transmission, most common is direct, typically saliva or nasal secretions from an infected person. So as expected, crowded conditions do increase the rate of transmission, like schools, daycares, things like that. They facilitate that transmission because people are in close quarters, can spread easier. It's from large respiratory droplets, like such as a cough or a sneeze. But then of course it can be transmitted from an infected person if they're kissing, sharing cups or eating utensils, sharing that with the infected person. That will definitely spread it. Diagnosis, so there is a rapid test that you can do, and then there's also a throat culture to confirm it. So the rapid tests have high specificity, so their true positive is high, but their sensitivities can vary, so they're not as accurate with their true negatives. It's not as accurate. And the rapid test detects the group A carbohydrate antigen. So these pictures on the right, it's you can see like the beta hemolysis. It's that colony for the Streptococcus pyogenes. And then on the left is what the rapid strep test actually looks like. So it's pretty interesting because I run multiple of these every day at work. So it was really actually fun to kind of learn about this more because, of course, you know, I never really think about exactly what I'm doing at work when I'm running a strep test, but makes me a little more informative and can help out patients better, which I thought was cool. Treatment, so amoxicillin or penicillin are usually the go-to antibiotic for treatment. If someone is allergic to penicillin, you can use azithromycin or like a Z-Pak. Treatments are helpful because it shortens the duration of symptoms, so it just makes your life a little more comfortable sooner. It decreases the risk of transmission, so stop spreading it. And then it prevents the development of complications. So, you know, the possibility that it does go to toxic shock syndrome or something of that sort. Prevention, of course, as we all know now because of COVID, wash your hands, cover your mouth while coughing, sneezing, things of that sort. Don't share utensils with someone who's infected, you know, all that stuff. So there's not a vaccine, and the immunity actually depends on the body's ability to produce an antibody for that specific M protein that I mentioned in the virulence page. So it really comes down to that M protein, and that's where your body can build that immunity is because of that M protein. So special comments, most common in ages 5 through 15. It has been studied for over 130 years, but the virulence is still somewhat ambiguous, so I thought that was kind of interesting. 15 to 20% of children are carriers, but they're asymptomatic. So I thought this was interesting because if you test a child, they most likely will be positive for, you know, strep throat, but they're asymptomatic and they're not very contagious. When they're asymptomatic, it's not very contagious. So this could potentially lead to the misuse of antibiotics or overuse of antibiotics because the children are on antibiotics when they don't really need it because they don't have a high rate. There's no really an infection. It's just they have some of this bacteria in their throat, made them test positive, but they don't really need the antibiotic. And then evidently 12 hours after the first dose of amoxicillin, you're not contagious anymore. So that was pretty nice because, you know, people want to get back to work, school, things like that. It's nice that you can do that without spreading anything. References and some questions for you guys, okay? Thank you very much.